Brad Williams, Frugal Finance, Medicare Supplement Insurance, an overview. What is Medicare Supplement Insurance? Medicare Supplement Insurance, commonly referred to as Medigap, is a policy sold by private insurance companies that help cover healthcare expenses not paid by Medicare. It addresses out-of-pocket costs such as deductibles, coinsurance, copayments that are typically part of the original Medicare plan. Key points: Medigap supplements Medicare by covering gaps in coverage provided by the original Medicare plan. This insurance is offered by private insurers, and individuals pay monthly premiums directly to the company offering the plan. Medigap is distinct from Medicare Part C, also known as Medicare Advantage, which is a different form of coverage. How Medicare supplement insurance works: Medigap helps fill in the coverage gaps left by Medicare Parts A and B. To be eligible for a Medigap plan, you must be enrolled in both Medicare Parts A and B. Medigap policies do not replace Medicare, but work alongside it to lower out-of-pocket expenses. The Medigap open enrollment period starts the first month you are covered with Medicare Part B and lasts for 6 months. This period is crucial as it guarantees the right to purchase Medigap without facing higher premiums or exclusion for pre-existing conditions. Medigap policyholders are required to pay separate premiums for both their Medicare Part B and their Medigap plans. Medigap plans come in 10 standardized types labeled from Plan A, Plan N. Coverage provided by each plan is uniform across insurers, meaning that regardless of which company offers the plan, the benefits will remain the same, allowing you to compare costs more easily. It is important to note that as of 2020, Medigap plans no longer cover the Medicare Part B deductible. Consequently, plans C and F are only available to individuals who were eligible for Medicare before 2020. Existing beneficiaries can keep these plans, but they're not available for new signups post-2020. Special considerations for Medigap: Medigap policies typically handle claims directly with healthcare providers. This means that in many cases, after Medicare pays its share, the Medigap insurer covers the remaining amount. However, Medigap does not cover services like dental care, hearing aids, vision, or long-term care. Emergency medical services while traveling abroad are generally covered by most Medigap plans for up to 60 days, subject to coinsurance and deductibles. It is important to be cautious when shopping for Medigap insurance, as some policies may involve high-pressure sales tactics or offer coverage to individuals who already have conflicting insurance like Medicaid or Medicare Advantage. In certain states, Medigap plans are subject to additional regulations to ensure consumers are protected. Medigap versus Medicare Part C. It's easy to confuse Medigap with Medicare Part C or Medicare Advantage. While both types of plans are offered by private insurers, they serve very different purposes. Medigap policies supplement the original Medicare coverage, Parts A and B, helping with out-of-pocket expenses. Does not cover costs associated with Medicare Advantage Part C. Medicare Part C or Medicare Advantage replaces original Medicare coverage altogether. It may provide additional benefits such as coverage for dental, vision, and hearing, and may have lower out-of-pocket costs compared to traditional Medicare. However, it usually limits coverage to a network of providers and may require prior approval for certain types of care. Unlike Medigap, which is supplemental, Medicare Advantage plans are a replacement for traditional Medicare, and you cannot use both at the same time. The parts of Medicare is divided into different parts, each covering specific aspects of healthcare. Part A covers hospital stay, skilled nursing facility care, hospice care, and some home health services. While Part A is free for those who have paid Medicare taxes for a sufficient period, it comes with a deductible and coinsurance costs. Part B covers outpatient services, doctor visits, preventative care, and some medical supplies. The standard premium for Part B in 2024 is $174. In 2025, it's $185 per month, plus an annual deductible of $257 for 2025. Part D offers prescription drug coverage and is available through private insurers. Medigap plans no longer include prescription coverage for new enrollees, but those who had it previously can keep it. When to buy Medigap insurance? You can apply for Medigap insurance as soon as you enrolled in Medicare Part A and Part B. The ideal time to purchase a Medigap policy is during your open enrollment period, which begins the first month you have Medicare Part B and lasts for 6 months. Buying Medigap during this window ensures you have access to the best rates and guarantees acceptance regardless of your health conditions. What does Medigap cover? Medigap plans help cover the out-of-pocket expenses not paid by Medicare Parts A and B. These expenses include copayments, co-insurance, and in some cases, deductibles. However, Medigap does not cover prescription drugs, dental care, hearing aids, vision care, or long-term care services. Does Medigap cover pre-existing conditions? If you have pre-existing conditions, Medigap insurance typically has a 6-month waiting period before it will cover these costs. However, if you had at least 6 months of continuous credible coverage before applying for Medigap, your insurer is required to cover pre-existing conditions right away. Conclusion: Medicare supplement insurance, Medigap, provides valuable coverage for out-of-pocket costs that aren't covered by Medicare. It is sold by private insurance companies and can be purchased after enrolling in Medicare Parts A and B. Medigap is different from Medicare Advantage Part C and complements the original Medicare plan by covering common gaps. Purchasing Medigap during the open enrollment period is important for ensuring the best coverage and premium rates. Comment: if you have any questions related to Medigap insurance, check out my long list of Medicare-related videos under the playlist Medicare. Brad Williams, Frugal Finance. Thanks for watching. Hope that helps. See you soon.